Now, Eastern Cape Premier Oscar Mabuyane has issued a stern warning to private hospitals. He says if they don't comply, they will be shut down. He was responding to reports that COVID-19 sufferers are sharing a ward with other patients at the St. Dominic's Hospital in East London. Khaya Sodidi from the Democratic Nursing Organization, that's Denosa, he joins us now on the line from Port Elizabeth. Mr. Sodidi, thanks for your time. Let's start with the denials by the Life Healthcare Group. They're saying that 42 nurses claimed to have been infected with COVID-19 at this particular hospital, the St. Dominic's in East London. That's simply not true. It's only 3 nurses. What do you know?
Good morning, Toli, and to the eNCA viewers. Toli, we want to confirm the news that more than the 3 nurses have been infected. So what has been issued by the management in healthcare and Life Healthcare in East London is a lie and denial. That is our response.
So how many nurses then, to your knowledge, are infected at that hospital?
For the 42 that has been communicated, that's a number we know. What we can say only about the situation there is that since the arrival of the COVID-19 in our province, we've been receiving reports, I'm talking about early days now of COVID-19, we've been receiving reports about nurses getting infected in private sector, in particular Life Healthcare. So it cannot be now, so many weeks after that, you can only have 3 nurses. So it is a lie and a denial.
Mr. Sodidi, you've got to tell us here, because you are the ones on the ground, what exactly is the practice, or what are the protocols that are followed by the Life Healthcare Group when it comes to COVID-19? Because it's not just St. Dominic's in East London, there's also St. Mary's in Umtata where similar claims have been made. What do you know about this hospital group's stringent operations when it comes to handling this virus?
Let's start by saying that the private sector has not been doing well at national level, and Denosa has condemned that, our national leaders. If you remember, for example, in KZN, it was St. Augustine, Medcare, and in Gauteng, it was Mediclinic, and now in the Eastern Cape, Life Healthcare now is showing the same and following the same trends. Only what we can say is that since the arrival of the virus, the Life Healthcare Group never stick to the guidelines, rules and guidelines of COVID-19. Because what we have discovered, like I said earlier on, during the early days of the virus, we received reports from the nurses saying that they have never been issued with the PPE, that was for starters, and they were begged to talk about the virus because the hospital or the group was in a good picture as if it's all well. So all those cases were hidden by the management. Everyone was scared to talk about it. Even the staff, they were told that they should not wear the mask or PPEs because they're going to scare off the patient. So that's what that's what they are doing. So they never followed any guidelines of the COVID-19, the national guidelines. So that's where the problem started. And now we're not surprised of what now has come out. And correctly so, as you have put, last week we were dealing with St. Mary's for a similar case, that's St. Dominic's, and it's been reported across the province. Queenstown, you go to PE, it's the same story, and it's the same group, Life Healthcare Group. And we're not saying others are doing well, but this group has demonstrated that indeed they have not taken measures and to protect their staff and the patient for that matter. Was also received slowly from the community members who have complained. We have been in those hospitals in Tata and East London that the way they've been treated, have been discharged 2 days after being confirmed positive, discharged home. We got one story from one woman saying that I'm staying with my grandmother who's 80 and with her child who was 6. Yeah. And she was discharged home to go and stay at home while she was only 2 days confirmed positive by the St. Dominic's Hospital.
Here's a question for you then, Mr. Sodidi. Is it enough that the Premier of the province is threatening a shutdown, or in your view, should he be taking much stronger action? In fact, it should actually be seen by acting as opposed to making threats.
We welcome what the Premier said, and that's what we're looking for. But what is also encouraging actually, after we had this news, what we did, we reported this as Denosa to the MEC and head of department in the province. And what they did, we're happy that last week we saw the National Chairperson of Health Portfolio, Dr. Doma, was in the province, and he visited St. Mary's in Tata. Therefore, I hope that there's intervention done, but not only by Premier, but by the health officials, because the department is issuing the license, so they can be ones who can withdraw the license. So it's not all about the Premier, but we see that National is also doing something when Chairperson was there to touch on last week.
Very briefly then, it's not just the private healthcare environment that is being complained about. The health minister also pointed to public healthcare institutions, or in other words, public hospitals, that are also seeing nurses being infected. He says the number stands at 58. That's at the last count. What is the situation in public hospitals?
Yes, we see a steady increase, disappointingly so. We see a steady increase. Yes, at the first, it was the private sector more infected, but now we see public sector is also now coming up now, because we get new cases on daily basis of the public sector healthcare workers being infected. So that's the situation, and we are monitoring that, and we are getting weekly reports, and we are ready to raise our red flag once we see that in the out of hand.
All right. Khaya Sodidi, he is with the Nursing Union Denosa. Very interesting reports coming from the Eastern Cape, and that is ahead of national government officials descending to that province one more time.